Live, and today with Gradlinc we have Dr. Hentas van Zyl. He is an orthopedic surgeon currently working in the Western Cape. Welcome, Dr. van Zyl.
Thank you very much. Happy to be here.
Yes, so we actually promised the audience that we will have a female orthopod, but I think it's a very good example of what happens in real life, because at the last minute there was a case and she had to go and we got someone else luckily standing. So thank you very much being available on such short notice. But I want to kick off. We've got 30 minutes just to get to know a little bit more about your life as an orthopedic surgeon. And the first thing I want to ask you is, just, from your student days, perhaps if you have a little bit more info, maybe from school days, but what was your journey like and your career to get where you are today as an orthopedic surgeon?
Yeah, I think the road starts very early for most of us. And generally it's at school, and you have to choose what you would like to go and do one day. I was lucky in the sense I never had another option. It was always medicine, kind of nothing else. But it wasn't orthopedics from the start. So went the normal route from school, studied medicine at Stellenbosch, and it was only probably about a year or two after finishing that orthopedic really appealed to me. After starting to work in the field a little bit, I think it's as you at school don't really know what medicine entails. You don't really know what the specialities entail until you work within them. And then it was the road to become an orthopedic surgeon, which at this point it is a slightly longer road, needing to get a few exams behind you, getting some experience, and then looking for a post to specialize. I was fortunate enough to get a post at Stellenbosch again, and qualified about 2 years ago, and then went on a little bit further into upper limb and specific hand surgery. So longish road, but I guess it depends on how you look at it. I got to be a student for a very long time, so probably a good thing.
That's never a bad thing. There's always some discounts at the aquarium, right?
Yeah, absolutely.
So you're saying, it's been quite a road. Can you, from the top of your head, how many years have you been studying since first year of medicine until where you qualified?
So, giving away my age a bit here, but started pre-grad in 2004. It was then 6 years of medicine, the 2 years of internship, and then a ComServe here. I got into orthopedic post relatively soon thereafter as a medical officer. So spent another 2.5 years as a medical officer before becoming a registrar, which is then for the surgical sciences another 5 years. So it adds up. I finished when I was 36. Yeah, end of 36 year. So life happens in between as well. Family starts, and so there's a bit of a balancing act. But the good thing is the last couple of years you're already working within the field that you enjoy and that you want to do for the rest of your life. So apart from the studying, you're basically already an orthopod, which makes it a little bit easier. Obviously, the studying in between adds just a bit of pressure at times.
Sure. You're talking about age. Is it the typical age in your 30s that you would be if you decide to not be a general practitioner and, GP opening a practice, but you want to specialize? Is that kind of the road to take?
Yeah, I think for most of the surgical sciences, there's quite a lot of applicants, and there is a bit of a waiting period. It's very rare to get a registrar post directly out of ComServe. At the moment, for orthopedic surgery, you're probably looking at about 2 years of medical officer time before starting to specialize. So you're generally only starting around your 30s, maybe if you're lucky when you're 30, probably around 31, 32. Then it's pretty good going. Like I said, it's an interesting concept as you're still a student and you're studying, but you're already doing what you want to do. You're already within the field that you want to practice. And I must say, and I can't speak for all universities, but it is actually a very good time because you're sitting with a bunch of friends around you, colleagues that's in the same boat. So I don't think the studying obviously takes its toll, but it's not that bad. It's not all bad.
But perhaps it's a really good point that you're making. You keep on studying for many years, but you're never alone on this journey. I think many students feel very lonely in postgrad because you're the only one that's deciding to do some master's degree in an area that's maybe you're the only one, or this, it's very rare. And it's easy to think, wow, in your 30s it's such a long journey, but I think it helps if you're not alone. There's always someone in the same boat as you.
Yeah, absolutely. For Stellenbosch, we've currently got 21 registrars. So you've got 21 people around you, give or take a year or two ahead or a year or two behind you, and that's in the same boat. That's walked the same road, done the same exams, and because we realize postgraduate or after you've specialized, you kind of realize it's not just a 26, 27-year-old that comes to specialize. So there's a lot of space for family time. There's a lot of we realize life happens in between. So it's not just studying, and like you say, you've got colleagues and friends around you that's going through the same, and eventually it's something you choose firstly, and it's everything is a preparation for finishing and being independent surgeon after it. So it's there's method in the madness, and I think it's not probably as bad as it used to be. There's a lot of leeway and grace for family time and sorting out your life outside of medicine.
Sure. I think it's a good thing. I don't think anyone would want to study for that long and not have something else going on in their lives, just moving forward. No one can wait that long.
No,
okay, well, speaking of your work, can you take me through a typical day in your life? I mean, maybe I should also mention that I know you are working in one of our academic institutions, so I understand you're not in private practice, which is a completely different setup. But yeah, please tell me more about your setting and what your day looks like.
So I think there's a lot of similarities. Obviously, the building looks a little bit different in private than in state, but there's a lot of similarities in the sort of daily workings of a surgeon, and the rhythm changes from time to time. But in general, your morning starts relatively early, around about 7:30, 8 o'clock, and specifically for us, we do a handover meeting of all the cases that's come in the last 24 hours. And they get discussed between consultants and registrars, and plans made for everyone. So that's sort of the acute admissions that get sorted. And then generally, either you'll have a theatre day, which would then be a 8 to 4, 8 to 5 theatre slate, where you run a theatre and sort of just manage the wards and the patients outside as they come in. But we're fortunate that we can organize that on clinic days. So alternatively, it would be theatre for the day or clinic. A clinic would comprise for us anything between 40 and 60 patients per day. Fortunately, not just for myself, but for we're usually about 6 or 7 doctors, surgeons, and registrars in the clinic. And then in between, we manage to do the ward rounds, so all the inpatients, both pre-operative and post-operative. I think for me, there's a big emphasis on balance. So generally there would be some form of exercise either in the morning or in the afternoon, whether it be taking my girls for a cycle or exercising myself. I put a lot of emphasis on that. And on-call days for orthopedics is relatively okay. You manage the emergencies as they come in. For us, the registrars, they've got busier on-calls. So they'll be on call for 24 hours, managing any case that comes in, either be it in the front room or in theatre. And then from a consultant point of view, our on-call is sort of overseeing any happenings in that 24 hours. So it's a busy day, but busy days go quicker. And like I said, there's a bit of a rhythm that you come into alternating between theatre and clinics.
It does sound busy, but it does sound interesting. If you alternate between theatre and clinic, maybe some days it can get quite hectic standing on your feet for so long in theatre. I mean, on average, are your cases really long?
Yeah, so for myself, doing upper limb surgery, they're relatively short, and we get to sit down quite a bit, which is not a bad thing. But obviously, if you're doing hip replacements, if you're doing spinal surgery, the cases do get a bit longer. For spinal surgery, it can be anything from 45 minutes to 12 hours of ongoing surgery per case. Hip replacements generally around hour and a half to 2 hours, and then the general cases are you average around an hour. So you just fit as many as you can into the day to get the workload done.
Sure. So if you're saying that you're doing upper limb and you specialize in it, was this post your training, or how does it work? If you say like you're really passionate, you want to, I don't know, maybe do knees, or you want to do hip replacement, how does that work?
So in general, orthopedics don't have an exit exam for their subspecialties. So technically, you'll be a general orthopod with an interest in a certain field. We've recently set up fellowships, which you do post graduating as a surgeon, which generally is about a year, where you go visit a center and train under them. So for myself, it was a year fellowship, doing both shoulders, elbows, and hands, but with a specific interest in hands. And that you do post qualifying, you're already a consultant, and it differs from fellowship to fellowship. Usually they are industry funded, so you earn a salary while doing it, but you usually have the freedom to go work in private or assist in extra cases for an extra income. But yeah, about a year post finalizing your degree, but there's no exit exam, there's no new qualification. You get a certificate saying that you've spent some extra time within a subspecialty.
Okay, that makes sense. Thank you. If there are any questions, please just look. There's a chat option, there's a Q&A option. Drop your questions there. I'll pick it up as we go along. You mentioned, you do work in private, and I mentioned before that you work in an academic institution. What are your career paths? Once you specialize, it sounds like you can do both, or do you have to choose whether you stay in an academic institution? And what is the difference between staying, say, in state, or then moving to private?
So generally, very few graduates actually get a spot in state. Staying in state is it's a very safe place to be. Just as you've always got colleagues specializing with you, you've then got a team of consultants with you overseeing cases. You're sharing the call roster. So there's a lot of support that comes with staying in state. And generally, it's dependent on whether there's posts available. And for a junior surgeon, it's generally quite a good place to be in terms of experience, in terms of leadership around you, and guidance. In terms of going to private, once you've qualified, you are fully qualified and able to go to set up a private practice at any hospital that you choose to. And then you basically, you're not employed by the hospital. Any of the private hospitals or private groups. You send them your registration papers, and they give you permission to practice. So in terms from income point of view, it's completely dependent on your own billing. You run your own billing practice, and payment from patients and medical aids. So you're very self-reliant then. There's also support. I haven't done a lot of private, but it can be a bit more lonely than it is in state, because the practices are all separate. They don't run as group practices in general. And then you sort of run the same type of rhythm as in state, where it's a combination of seeing new patients, theatre days, and then following up patients. And then in between, you do the trauma cases that comes in on call. whether it be within your own field with other surgeons or just whatever comes in.
Okay. In terms of opportunities then overseas, private or state, I know it will differ from country to country, but are our qualifications generally recognized internationally as specialists, or do you have to rewrite exams? Or if you have to, like from the top of your head, do you know which countries allow South Africans with their qualifications and which ones perhaps not?
So most countries, almost all of them, allow fellowships. So further training, and you get appointed as a trainee, and you get your working visas accordingly. So in terms of doing fellowships, all countries are basically open. In terms of registering in different countries, they do differ quite a bit. So short-term stints, I think it's 3 months or less, you can do, for example, in Ireland without extra registration. A place like Australia, I believe you actually have to rewrite exams. The United States, you almost have to go back to general medicine exams to at least some of the basic subjects you have to rewrite. The UK at the moment, they're pretty open from a fellowship point of view, but you can apply once you've worked there for a year. You can get GMSA, their medical registration, and then you're allowed to work there. So most of them will have at least a stint of either a fellowship or work experience, and then you can apply. I think it's Australia and the US are quite strict, so you have to basically rewrite exams. What I can say is they really do appreciate our level of expertise when it comes to trauma, and specifically open fractures, motor vehicle accidents, interpersonal violence. It's stuff that we see very, very commonly that they don't. So they really, really value our opinions and skills when it comes to trauma. They spend a lot more time on elective type work and then elderly fractures. So there's a lot of back and forth, and we do get a lot of overseas students that just comes for trauma experience, and oftentimes self-paid for up to 6 months, just to come gain some experience.
It's quite mind-blowing that we get to train people from other countries, and it's well known that South Africa is one of the countries offering the best doctors, and yet you have to rewrite exams if you go somewhere else. And I understand in the medical field, you know, you're working with people's lives, but you know, it's a sad reality that's a huge barrier for some people. Imagine if you're a little bit older and you haven't written exams in quite some time, to relocate. I'm sure that can be quite tough.
No, definitely, and especially if they go very general. If you have to go back to general medicine exams, because realistically, by the time you want to write those exams, you haven't spent time in general medicine for a good 10 years. So it makes a difference, difficult, but that's where I think the countries where they definitely take work experience into account, and specifically work experience within their country, I think that makes it a lot easier and it makes a lot more sense. Sort of in work evaluation.
Sure. I see there's a question, but before I get to that, I was wondering about it when you mentioned earlier, in your undergrad, you didn't necessarily know that you wanted to go in orthopedic. So what ticked that box for you? I mean, I see so many medical students, they start thinking about it in their 3rd and 4th year, and you know, when they're ComServe, they change their mind. It's an intern. It depends on the experience and the exposure, but surely there must be 1 or 2 things that really stood out that made you went like, you know what, this is what I need to do. What was it?
Yeah, so that's a very interesting question, and for a lot of people, it's very different. There's an interesting trend that you would see. A lot of orthopedic surgeons might have had an orthopedic injury at some point, and that triggered their sort of path down orthopedics. I don't know if it was because I liked building Lego when I was younger. I'm not sure if that was the case. So for me, I decided I knew surgical was the field. but I decided quite late. And for me, it was the sort of general orthopedic patient profile, being healthy, youngish people that you can help relatively quickly with a relative quick turnover. And I think it's for me, you see the change, and you see the change quickly. That's probably what triggered it for me.
I like what you're saying, like the Lego is, building and putting stuff together. And then I think it's really important what you are mentioning. It's a preference. It's a quick turnaround time, but I think it really affects when you have to make a decision in terms of choosing the discipline when you go into medicine, because if you have to wait long for the results, if you just think about something like oncology where you may never get the results that you want, you might not find that fulfillment. But if someone comes in with a broken leg, you fix it tomorrow, you see him walking, surely that leaves a very good aftertaste.
Absolutely, it is rewarding, and generally we've got healthy patients, but a lot of what we do also saves lives. It's not maybe the glamorous bringing the patient back from the dead that the trauma surgeon does, but you change lives, and you definitely improve people's daily activities, their quality of life, and through something we enjoy, which makes it really, really rewarding, and it makes the effort worthwhile.
100%. I just think of some kids, coming in with problematic spines or feet, and then you can see them walk, and they might have a little bit of a different gait, but that someone changed their life when they were younger to make it possible for them to be as functional as possible.
Absolutely. The kids are the most fun. Kids don't lie. They want to get better. The moment their pain is gone, the moment their alignment's back, they play and they're happy. They're probably the most rewarding patients.
I can imagine you actually giving them a second chance in life, because they might have been so inhibited by whatever function that they couldn't perform or disability that they had, that it's really life-changing. It's in a different sense than Grey's Anatomy, kind of vibes.
Yeah.
Or should I not mention Grey's Anatomy to doctors?
No, I think there's not a lot of orthopedics that watches Grey's Anatomy, so it's okay.
Okay, cool. So I've got a question here. I'm going to bring it up on stage. The question is that someone mentioned to me that it's easier for men as orthopedic surgeons because they're physically stronger. Do you think being smaller in stature is inhibiting? And, since we were initially and invited a female orthopedic surgeon, it is a very relevant question. Does it matter? Do you need to be super strong, big? Tell us more about that.
So I think there's a big stigma around it, that orthopods are big, strong, hammer-wielding men in general. Now, my nickname was Small Fancel because one of my colleagues was also Fancel, and he's about a head taller than me. And we both managed pretty easily. I think if you need strength, if you need physicality, you're doing it wrong. There's definitely way more space for technique and the way of doing things. You don't need strength. You don't need to be big. The bed can be lower to your level if you're not tall. If you're super tall but not strong, you can raise the level of the bed. It's way more about technique and skill than it is about physicality. You definitely don't need to be a bodybuilder.
That is a really interesting answer, because I also have this idea in my mind. You kind of need to look like Thor or something if you put in a hip replacement, and you always know they hammer something. And in your mind, you think you must be really strong to do that. But you're saying it's all about technique.
Absolutely. If you need to hammer that hard, you're doing it wrong, and you're gonna cause more harm than good. So no, it's absolutely technique and skill.
Sure, that's very interesting. And then I've got another question. We've got about 5 minutes left, so if there's one more question, I can take it. But this question is, helping people and making a difference is definitely the most rewarding experience. But what's the difficult part, the part that isn't discussed?
So it's definitely less glamorous than Grey's Anatomy makes it. There's a lot of times that you sit behind books and you're frustrated, you're irritated, you see the messages from your friends that maybe did something different, and they're sitting on the beach while technically working. But there's the long road, the long hours. In every step of the way, you can find something good. There's a lot of times where you, at your most tired you've ever been, and that's a patient that you just spend one extra minute with. You just hunker down, spend one extra minute with, and that's the old lady that brings you a present, even though she couldn't afford to get a taxi to get to hospital. So it's not as glamorous. It is long hours, but it's still rewarding. And I think once you get to the end, I think in medicine there's never an end. You're always going to learn more. Every day there's going to be something new. But once you get past the formal exams, your bandwidth expands, and your ability to see the good in every case. Even the patient coming complaining, there's always something good to see. So even though it's not glamorous, I think it very much depends on each person. The hours are long, the studying is long, but every step of the way there's something good, and then one must just do the due diligence to look for that little something good.
Sure, yeah. And then I have a final question, and you kind of alluded to it before. Work-life balance. I don't know if that's a term that is like generally relevant to doctors, but in terms of the different specialities, maybe there's an undergrad student, or maybe they're an intern, or they're starting out now, and they're thinking, how do I decide what I want to do today or one day? There's a couple of things I'm interested in. But how does the work-life balance compare in general, to other fields? Is it really good? Is it average? Is it really bad?
I think orthopedics probably falls somewhere in the middle. We're definitely not as bad as a trauma surgeon that gets called all hours of the night. Once you've finished specializing, you do get calls at night, and you do have to do some surgeries at night. But generally, for a postgraduate orthopedic surgeon, you sleep in your own bed, and you can manage most of the stuff during daytime hours. So it's not as bad as a trauma surgeon, for example. It's not as good as a dermatologist, who never gets called at night. So there's definitely a spectrum. I think you must just be able to cope with what you have to do on your day-to-day basis, with knowing what the after hours input needs to be. You're never going to be happy doing something without after hours, which you absolutely hate. But you also need to have a life. You also need to raise a family or be part of a family. So you have to sort of individualize for yourself, but orthopedics probably somewhere in the middle. It's not the worst, definitely.
Yeah. I guess, wrapping up the session, it's important to remember it doesn't matter which discipline you go into. I don't think any job is ever going to be 100% joyful. There's always going to be pros and cons. And I think, if you can get to a point where 80% of what you do, you love, then it makes up for that 20%. And perhaps the 20% is admin for someone. Perhaps it's the difference in the work-life balance for someone else. But it's good to understand, how it compares. So thank you for that insight. I think if it helps one or two students today thinking about, whether they have to choose between going into orthopedic surgery or something else, hopefully that clarified it a little bit. We have reached the end of the session. Dr. van Zyl, thank you very much for your time. You must be really busy. I'm sure you're going to have a relaxing evening. Thank you so much for making the time to talk to us. And all the best for the rest of yeah.
Thank you very much. It's a big pleasure, and if this guided somebody towards orthopedics, great. It is worth it in the end.
I'm sure it is. Thank you so much for your time.
Thank you. Cheers.